Hi, I'm Chris Estle. I'm the Jefferson County Public Health Nurse Administrator. I've been in that position for 15 years, and today we're going to be given the opportunity to give you an update of some programs that we're offering at the health department. But first, I want to take a step back. I'll have Deb introduce herself, and then I'll give a quick little update. So go ahead, Deb.
My name is Deb Buch, and I've been with public health for 13 years. Overall, I've worked in home care and public health for about 23 years. So we are just going to tell you about what our department does. So many people have no idea what we do at public health, so hopefully you'll learn a little bit from what we have to say.
Yeah, we're given the opportunity to kind of provide some education and information through this forum, so we're very thankful and appreciative of that. So we all know that public health has been in the limelight for the last several years. So today we're going to talk about some things that we're offering at the health department. For many years, we offered home care services. We had a Medicare, Medicaid certified home care agency. And about 4 years ago, we decertified from that process. We did not want to be in competition with the private entities that provided that service within our community. So with that being said, things changed a little bit. So we're coming back this year. We have always had local public health services grant dollars that allowed us to provide service on an income-based sliding fee scale. But now our grant has changed, and more of the focus is on population health. And people are kind of like, well, what's population health? Well, population health is just that. It's the health of the public and of the population. So when our grant funding changed, we were able to do some things differently within our health department structure and the services that we offered. So every 5 years, health departments are required to do a community health needs assessment, health improvement plan. And from our previous health improvement plan, we've identified some gaps in some population health or services that were a priority. So I'm going to turn it over to Deb and let her talk about the Ask a Nurse program. And we've worked with lots of different partners like Mindy from the Chamber, a private business and industry. But I'm going to go ahead and turn it over to Deb because she's really the community education nurse. So go ahead, Deb, and give us a quick update.
Okay, so Ask a Nurse program is essentially 2 different programs rolled into one. Part of it is community education, where we try to reach as many people as we can at one time, the community-based health component. And the other part is of Ask a Nurse is just people needing health advice. So we started this last April, and since last April, we've probably touched about 500 different individuals. I have 100 that I see consistently every week, so that's really exciting to have a lot of the same people and get to know them. I go to, 3 different, I would say, high rises or
Senior living.
Yeah, senior living.
Yeah.
And it's just a time where I go 1 hour a week, and anyone who wants to ask a nurse a question can come in. It's worked out really well because most of us just see the physician every 6 months. And so in between, if something would come up, any questions about medication, or all of a sudden they start to develop different symptoms, they can come and visit with me. I don't diagnose, I just try to give advice and always refer them back to their provider.
And it's confidential.
Yes, it's
because
all.
you are able to meet with them like we're meeting, but it would be in a little private area, so no one would hear the conversation or the questions that someone would ask.
Right.
So
right.
just to be HIPAA compliant,
Yeah.
we want to make sure that that's addressed.
Yeah. And so they all kind of wait in line and wait for the next their turn. So it's kind of fun to see people week to week and a lot of new faces. So that's the Ask a Nurse component, and
they can call the office too.
Right.
And if it's somebody that is in the community that doesn't live in one of the senior
Right.
living apartments or complexes, they can call the office and ask for Deb, and you can set up an appointment, and Deb or I or one of the other nurses can help with that. So
Right.
do you want to talk a little bit about that? Because that was kind of the community health liaison
Right.
program that we
Right.
kind of changed a little bit because it just didn't
take off
like we thought it was going to.
Yes, and these are all free programs that we do.
Right.
So if someone doesn't live at one of these senior living complexes, They are free to call our office. They can talk to us over the phone if they have a question, or they can come in and we'll sit down with them. Maybe they want to go through their list of medications. They have questions about different things. They may have an upcoming physician appointment and they just want to get our input on what should I ask, what do you think I should know? So we can kind of help them through that, and that's worked out really well. So we're hoping to kind of increase the community liaison part again. The other thing is the community education. I've been going to the community center. It used to be the senior center.
Same location, different name.
And it's very nice. We usually have 25 at least that come every time. And I let them pick whatever topics they want to know more about. So we've done everything from Parkinson's to arthritis to back pain to sleep problems to blood pressure problems, heart health, congestive heart failure, just all kinds of things. And that's been a lot of fun. I try to make it so no one falls asleep on me. And I do a lot of like different posters and props, and so we have a good time with it as well. And I always have to be done by 12:15 because that's when bingo starts. Otherwise, I'm dead. So
we don't want to interfere with bingo because that is a very good thing for seniors to participate. Anyone to participate at the community center. It's so much fun.
And so many times I just want to stay myself
I know.
and play.
I know.
So that's the two components of Ask a Nurse.
And I think the thing is, oftentimes, when even as nurses, we have to see our medical providers as well. And, when you're the patient and, the first thing you do is they call your name and then they make you get on the scale, right? That's like stressful. Yep. Then they check your blood pressure, reconcile your medications, meaning, they review your medication list, any new allergies, what your chief complaint is. And by the time you get set down, number one, you're overwhelmed sometimes just doing that. And then if you hear some really traumatic news, say you're just a diagnosis with, cancer or Parkinson's or a disease that you have to really stop and pause and think about, oftentimes our brains really do kind of shut down and we cannot process and are able to articulate or ask a question because your brain is going someplace else. So even if it's something as, please don't ever hesitate to call the health department. I think that's the health department. I think that's one thing that people think, well, I don't have any resources, but you do. We don't need to know all of your medical history, but you need to reach out to us and we're happy to, help you form a list of questions to ask. Like if you have older family members that are just diagnosed or, if you need to look at some different living options. Just call us. And all of that is kind of under the umbrella of Ask a Nurse. Right. We did not really know what to call this program, did we? We were like, what can we call this program so people really understand that they really are asking a nurse face-to-face questions, right? Because sometimes you think, who am I talking to on the other end of the phone? Are they even really a nurse? Do they really know what's going on? Do they know our community resources? And if we don't know how to help you, we get on the phone and we call people.
Right. We try to give you some answer. We don't say, I don't know. You're just going to have to call someone else.
Right.
We try to investigate. We're good investigators and get the answer for you. We have tons of people that call our office just to get, like, what's the WIC number? How do I get signed up for WIC? Where do I get STD testing? Just things
radon
like that.
Testing.
Yeah, radon testing.
Well water
lead testing. Just all kinds of things.
Yeah.
So we try to help. We're a great resource.
Yeah, it might not be something that our office offers as a service, but we definitely know who to put you in contact with within the Jefferson County umbrella. That's one thing that's unique to health departments in Iowa. There's 99 counties, so there's 99 county health departments. There's a couple counties that have a city health department as well, but every county at this point has a county health department. And every health department looks a little different based on their funding and the services that they offer. So if you see one health department, those services might be a little different. Right. And now this Ask a Nurse program is funded under the umbrella of our general budget. So there's no grant dollars tied to, quote, deliverables with this process. So you you prepare a report, just like you referenced earlier in the conversation. You prepare a report that's shared with our Board of Health members, and we just want to see the reach that this program has. And if anyone has talked to Deb or one of the other nurses, I would encourage you to, reach out to the county officials, because the Board of Supervisors does indeed fund our department just like they fund other county departments. So we are working as on behalf of you as taxpayers, and this is a service that is funded, with tax dollars. Some of it is funded with our state grant focusing on population health, but Deb's program is indeed that's why we can offer it at free of charge, at no charge to you as a county employee, or excuse me, as a county resident provided by a county employee. So I have to always get that little funding plug in. I wouldn't be doing my job as the administrator if I didn't. But I think sometimes too, there's maybe a disconnect with, not knowing where to call. Like even if you're an individual that might not go to the hospital here, or the health center here, it doesn't matter. You can call us. We're still going to be able to help facilitate a list of questions, a list of resources. What we don't do, though, is we don't call their providers for them.
No. It's all, again, confidential. It's just between us, unless they request us to call the doctor on their behalf. But otherwise, we don't.
Right. And the thing of it is, it's really just to open up a communication as, I'm going to have knee surgery. What should I think about? Well, okay, you might need to have, some durable medical equipment. You might need to think about, what does my living arrangement look like pre-surgery, so I know post-surgery what I can do. So some of those simple things that we kind of take for granted as medical professionals that
you don't think of.
Yeah, you don't think about. I know a few years ago I had a broken wrist, and that really changed how I viewed how I could do things independently. And, you don't think about things like that until it truly happens. And then you think,
when you're in the situation.
Yes. So there's nothing like real life experiences that make you pay attention to your surroundings differently. So some other things that you have been involved with are some of the mental health meetings that have gone on in the county. You've been very instrumental in participating in those activities. As the administrator, I participate in lots of different advisory capacities with different meetings and programs. I think one other thing that we might want to talk about too is our immunization program.
And we do that the first and third Tuesday of every month from 1 to 4. We do all the childhood immunizations that are recommended by the Iowa Department of Public Health. We also have adult immunizations that we can do for a fee. The children, we have the Children for Vaccine program, so that is all free for the kids, which is really nice for those underinsured or who qualify. We, really encourage people to come to our office just because we are easy in and out. We get all of our appointments ahead of time, and then we can look at what the child needs, so we try to make it as easy as we can for you. We have 3 nurses that work the clinic, so we always have someone distracting the child, and we have great prizes, so that helps give us a good reputation for immunizations.
And some of the other things too, I think, like you referenced, we do have a few adult immunizations. The one thing that we don't offer, that we do get a lot of phone calls for, it would be like international travel vaccine recommendations. And we always tell people that are traveling to go to the vaccine clinic, or excuse me, the International Travel Clinic.
The tropical. Tropical Center in Iowa City.
Yes, and you can either Google that, or we have their phone number. And we always encourage people to, the minute you start thinking about traveling internationally, you need to start thinking about your immunizations and where you're at with your own process. So, because several of those vaccinations are a series of 2 or maybe even 3. So you want to start the timing of that. So we get a lot of phone calls about that. So I just wanted to take a few minutes and reference that. Some other things that we offer at the health department that people might not be aware of are our child care nurse consultant programs. And what those are, we have 2 additional nurses that are not here today, but Mandy and Tammy are both nurses, and they've taken extra training to become a child care nurse consultant, and you're probably thinking, well, what do they do? Well, they offer technical assistance and support for daycare centers, daycare homes, and preschools. So there's lots of education and lots of support that goes into the training that they offer for the staff and for like the center directors. Now, they are not regulatory. That is they just offer education. The regulatory component for registered centers comes from the Department of Health and Human Services. So that's separate. So we would not be doing a survey or anything like that. But what we would do is offer education and support for centers or homes that are going through maybe through that. So something as simple as, medication administration or hand washing, those kinds of things. So there's support for education in that realm as well. Mandy also is a certified playground inspector, and Tammy is a certified car seat technician. So we kind of have opposite ends of the lifetime spectrum.
Yes.
So I just kind of wanted to throw that out and let people know if you're a grandparent, new parent, and you need help with a car seat, those are important things as well. So, Deb, is there anything else? I think we've kind of touched on a lot of things.
Another thing we do is free blood pressure screening. I know that before COVID, some of the pharmacies had a blood pressure cuff where you could sit down and get your blood pressure taken, and now they don't have that so much anymore. So we're happy anytime we're during office hours if you just want to come in and we'll take your blood pressure for you. We also do communicable disease follow-up, and that's just to keep the residents of our county healthy. Anything that's transmitted by communicable disease, we do follow-up on that. We get the case from the Iowa Department of Public Health. We call the individual. We guide them through what they need to do to keep everyone safe.
And there's lots of other things that we do, but at this point, we I think we've kind of run the gamut with the high level things. I think the big focus was our Ask a Nurse program for today, but again, it's Chris and Deb from Jefferson County Public Health, and please reach out to us. Our phone number, I'll just throw it out there. It's 472-5929. If you want to bypass the auto attendant, hit 2, and that will get you to a real person. Our office hours are 7:30 to noon, and then 1 to 4 Monday through Thursday, and then Fridays we're open 7:30 straight through till 1. So leave a voicemail at the main mailbox or at one of the nurse mailboxes, and we're happy to get back with you. So thank you for this opportunity, and please let us know how we can help you.
Thank you.
Thank you.